Hi, it's us again. So we're gonna talk about something more educational, talk about the HIV and also how we prevent and what about HIV in Japan. I was viewing some data, and actually Japan has one of the lowest rate of HIV. It has 0.01% of the whole population. I think it's around 20,000 people compared to your country, Canada, which is about 60,000. So you guys have a higher rate compared to Japan. So I would see from the statistic on the chart, Japan's situation with HIV is pretty good.
Well, in Japan, my understanding is that yes, it is very low, but it's very centralized in the gay community. Simultaneously, it's good that it's low, but I think for 10 or 15 years, it kept on rising, the rates. My understanding of the research that I did is that it's actually started to finally go down again.
I feel it's still kind of taboo-ish in Japan. Nobody really talk about it. I don't hear so much conversation around HIV. Some of the news article I've seen recently are, for example, even HIV infected person go to a hospital and got turned away by the doctor. So I was actually very shocked to see that because as a doctor, you should know that HIV is not transmitted through a normal conversation or a daily interaction. It has to go through blood or sex or mother to child, right? When you're having a baby. Even people who are supposed to have this medical knowledge show this kind of very obvious discrimination and to people who have HIV.
When I was living here a long time ago, it was no one was talking about it, So the good thing about it is I feel like there is an effort now in the last couple of years to raise awareness. But a lot of people, I don't think there's much talk. If I'm on an app where I ask someone if we're gonna have sex or something like that, and it's hey, have you been tested, this and that, a common thing that I've been told is, oh, I don't do anything risky, so I'm okay. And I'm well, what does that mean? And sometimes it's oh, I have been tested and I'm okay. But sometimes it means I don't even get tested because I don't feel myself doing anything that's risky. I think that's part of that thing about it being taboo, right? There's that stigma. And so they don't think oh no, I'm fine. I'm not in that group sort of thing. Whereas, that's not, HIV doesn't discriminate. It'll, you know what I mean? It's not anything about the type of person you are. There isn't that much safe sex here compared to other places I've been in and lived. I think the use of condoms is lower.
It's lower here.
I've seen a lot more information and posters and awareness sort of campaigns to raise awareness around in the gay community.
We definitely see more banners in Nichome or in the other part of the city. For example, we saw one in Nakano, right?
Yeah. It's very much where the gays live. And in front of the station, even if you stand on the platform, you can see across. There's a big thing. So as you can see, we have the sign over there. We're on the platform for the Chuo line heading to Shinjuku. So it's actually a very major viewpoint where a lot of people can see it from right across the way. Also apps.
Apps, yeah, we definitely open up apps every single day. We see lots of banners about where to get tested and what kind of organization you can reach out if you find yourself, in the risk of exposing to HIV.
They're using go-go boys, for instance, to advertise safe sex, right? So you're going to these parties, right? And you're seeing these go-go boys and they're being used.
Yes, actually at the entrance of the party, they always pass out, condoms, the brochures, and also tell you where to, get tested. So they have all the information at the gay parties. Yeah. So I think it's a good improvement from what we had before, which is absolutely people avoid the topic, think it's taboo, but right now I'm more trying to educate people.
I think there is a push at the moment for education. There is a huge uptake in PrEP in other countries in the world, and PrEP here is largely unavailable. And the knowledge surrounding PrEP is really low.
Actually, surprisingly, I didn't know PrEP until last year. You guys took me to White Party. That's when I know, there is something that you can take a pre-protection for yourself, not getting HIV. So it's actually really relatively new to me as well, because I hasn't been followed up with the whole situation. I still thought like condom is the only way to protect yourself from HIV, but if you don't know PrEP yet, like just like me before, it is kind of like a little small pill that you take every single day, and can protect you for I think 92% from.
There are various statistics, but it's like 90 something to like 98 or 99. But that's the thing, is that I see barebacking here a lot without that knowledge and use of PrEP. So the cool thing about Japan is that even though like PrEP is not available to get domestically, in general, as long as it's medicine for personal use and isn't like a narcotic or anything, the law allows you to import from other countries.
So actually in Japan, there's a rule on ordering PrEP from a foreign country, because I order my PrEP from the website. So I import PrEP from other country. You actually can, each time you can only order one bottle. That's the limit. You cannot order like for 60 days or 90 days. One bottle though is usually 30 pills, so for 1 month. The other day, because of the corona situation, I couldn't order from online anymore. I kind of have to like look into domestic supply, and it's much more expensive. And I went on Japanese website, you actually like one bottle is like 15,000 yen.
Wow.
Well, when I import it, it's like something yen, so it's like 5 times. The more economic way is to import from another country, and which is fine in Japan.
Yeah. It's great that we can order it. That's super cool.
Right.
The problem with it is that PrEP could have side effects. Right?
Yeah.
So like the main thing that you're supposed to check is your creatine levels, because they could have a negative effect on your kidneys.
I had side effect to PrEP.
Oh, that's true. Yeah.
In the very beginning of the stage, I think it was the second week or the third, I started to have like dizzy head, and I threw up a lot when I had PrEP. But that phase actually went away really quickly after I continuously taking PrEP. Also at that moment I asked you, should I keep taking or not? And you said like, just keep going. And I went on with it, and I get tested in the clinic, and they say my kidney is fine. It just, in the beginning you had that, but like right now everything is fine.
But see, that's the thing, right? Like at times like that, I think like you should have a doctor there who can help you and take care of you from a professional point of view, right? So I'm so happy that I can get PrEP here, even though it's not officially approved in that way. And yet at the same time, there is sort of a side of like, ooh, I can just order something that could be really quite dangerous, and I can just take it willy-nilly. The good thing I found out was that there's actually now, even though PrEP has not been approved, they're doing research. So they're doing a lot of studies surrounding PrEP. And a friend told me that if I went to this clinic that's a little bit, closest to Shinjuku.
Right. Yeah. It's like 2 stations away.
Yeah. Even though I can't partake in the study, because I'm taking PrEP, they will allow me to sort of do my tests and everything there. And I think as a sort of exchange that they can use that data and stuff like that. And that's been great. I've been able to do creatine tests there. I think that's where you go now, right?
Yeah, that's where we all go together. I mean, not together, but just like at the same spot.
Yeah. And I feel like the doctors there are a lot more knowledgeable and
very friendly to the gay community. They were very open-minded. We help with the survey and talk about like how much sex we have. They were pretty open with that.
Yeah.
And also, I think recently there are more institutions or there are more clinics open up for the testing of your kidney.
Oh, really?
Yeah,
okay.
Because I just saw the advertisement on Nine Monster recently.
Oh, really?
Yeah, but it's quite expensive though.
Okay.
It's the same thing, they issue PrEP, it's like 15,000 yenぐらい. And also you have to like take another kidney test, which is more expensive.
The place to go is public health centers.
Yeah, they have it usually on Thursday and some...
every day or whatever, depending on the health center.
No, yeah, depending on the health center, but usually I think it's on a work day, so I'm not able to go there, like have a day off to go there. But most of the clinics will take HIV testing for like $50, like 5,000.
Well, that's my point though. So that's the interesting thing is like, they have them for free. So they do have a similar program that you'll find in other countries of like, you can just go, you can get your anonymous testing, this and that. They're very kind, it's very quick, and it's great. The problem, as you said, is that it's usually at like 10 a.m. in the morning or 2 in the afternoon on a weekday. So it's really only available to students or people with like very flexible schedules, or maybe they work on the weekend, but in the weekday they're off, right?
Sometimes they have on Saturday as well,
It's like times. Once, I find there's one that does like with HIV Awareness Month.
It's
They have, like,
actually
it's like
monthly, once a month.
There's a really good site called HIV Kenza.
So we're gonna put into
Put it
our
in the
description,
thing, which
yes.
you can like filter who speaks English as well. You can filter that
okay.
way. Do you see each other? Like, do you see people do you see people at night? Do you see people on the weekend? There's like a bunch of pull down sort of things that allow you to filter the results. Super useful. That's what I use every time I'm trying to like find a free place because
Yeah.
I'm super cheap. So
Andrew, I have another question for you.
Okay.
Should you wear condom when you give someone a blowjob?
I think the answer is yes. I think in reality people don't.
Okay. But you should, because there are a lot of virus in, like if that person has, there's another chance you can get STD, not only HIV.
But you can't really get it. There's not really a big chance of getting. There isn't
Chlamydia.
a proven. Yes, but there isn't a proven. The jury is still out regarding whether blowjobs actually have a danger for HIV. A lot of people think no, but yes, chlamydia, gonorrhea, stuff
Gonorrhea,
like that.
yes.
Wear condoms.
Wear condoms.
Get access to PrEP.
Yeah.
Enjoy yourself, and get tested.
Yeah,
Definitely.
and even if you have HIV, with the science today we have, you can basically live up to
Undetectable equals untransmittable.
And also don't discriminate someone who has HIV, because they really need a lot of support from other people. It's definitely a mental stress.
Yeah.
And also it's not transmissive if you're just talking to them, having a conversation, or interact with them, work together, or live together. So I think that's another important part that we want to advocate.
True.
Right?
True. Yeah. I mean, it's a. How do I? Yeah. No, I think you can just cut me.